Hello, this is Philippe Robert. I'm leading the client relations here at the Kusnacht Practice. We are reinventing the experience of care. And today we have with us Melissa Nobile, our psychologist. Hello, Melissa.
Hi, Philippe.
We are actually discussing a topic which has been very much on the rise in eating and body image disorders linked to the COVID-19 pandemic. Thank you very much for taking the time to answer those questions. So the first one that pops up in my mind is the referrals of young people with eating disorders for NHS treatments that shot up by almost half last year in England, according to the government data, with doctors warning that lives are being ruined. And there were close to 20,000 referrals of under 18s with eating disorders to the NHS-funded secondary mental health services in 2020, a rise of about 46%. So these are big numbers, which indicate that the anxiety caused by the pandemic manifests itself in a number of different ways, doesn't it? So, Lisa, how do you explain this?
You're going to get used to me saying this, I think, but I always say, oh, it's complex.
Yeah, of course it is. Yeah, we do believe it's complex. That's why we have you as an expert to help us today.
So it's complex. It's the result of, I know in your question, you said the link between anxiety and eating disorders. That's one of them. That's one of many. My second question would be, well, what's causing the anxiety that's behind?
Right.
That's all the job of a psychologist or psychiatrist to figure out, by the way. But
it sounds like I'm asking
dynamic.
complex questions too, right?
It's fine. I like it. But yes, with the pandemic, off the top of my head, examples of factors that could contribute would be that individuals who, maybe people lost their jobs. Maybe people had relationship problems that were more difficult to handle because they were in closer proximity. And in addition to that, it was harder to access support. So you can go see your friends, you can go do your sports, etc. So loads of different factors. There was also a huge contributor in my professional opinion, because I've observed it during the first lockdown especially. And that was that social media, there was this big message about needing to look after your body. Personal training online became a huge thing. On Instagram, it was a lot of, the use this time to get in shape, get in the kitchen, etc. And obviously eating disorders, they go hand in hand with how you perceive your body image. And so individuals, a lot started dieting during that time, or they started working out to, I'm just going to aim at this body. But very quickly, for some of them, there's a loss in control over the process, and they get stuck in a cycle of maybe dieting or exercising or both. Or I'm going to lose weight a little bit more quickly so that when lockdown's over, I'll look better. And before you know it, you're in an eating disorder and you're stuck in a pattern of restricting, binging. Yeah. I think that would be one factor. And then I think never to forget that all these symptoms, whether it's an eating disorder or a major depressive disorder or agoraphobia or whatever it is, they exist in the context of a broader environment and someone's life story. And I think of a client I had recently who was 16 years old and who came with an eating disorder that had developed during the pandemic. And I worked with the family in a family setting in this situation. And by asking questions, we quickly realized that so this teenager was going to boarding school before the pandemic. There was some problems at school with bullying, wasn't having great grades, came back home in the pandemic and experienced that as a safe place. All these things were discussed in therapy. They had never been discussed together as a family. And as soon as the lockdown was coming to an end, this teenager was starting to develop eating disorder symptoms. In his case, it was anorexia. So he was really, really restricting. His BMI dropped quite low, quite quickly. And so he stayed home, didn't go back to boarding school, got stabilized during the summer. And then in September, when it was time to go back to boarding school, the symptoms started again. And we could see in this context and exploring all these questions with the family and the youth, how these symptoms actually of the eating disorder they allowed this youth to not go back to boarding school and stay home in the safety of the family. And that was something that completely unconscious, it's dynamics that come into place. And once that was addressed, we could work differently, and the symptoms faded away actually really quite quickly, because we discussed, okay, how do we stay in a relationship as a family when we're not living together? And we could talk about loads of questions, and we didn't even talk that much about the anorexia. And now that person is doing already, I think, a lot better. So the reason I give that example from my clinical practice is really to illustrate how it's complex, and the job that we do at the Kusnacht Practice, or as psychologists, psychotherapists, psychiatrists, is to understand for each family, for each individual, what are the contributing factors that explain why it is that you specifically are having an eating disorder, with general traits like anxiety, to come back to the question you asked.
Fascinating, because for two reasons. Number one, the conjunction of factors that you're explaining is not just coming along as an eating disorder, there's an underlying cause of it. And the conjunction of those factors is still to be analyzed to precisely understand where it's coming from, is my first learning listening to you. And the second learning listening to you is actually how close this is to the program that we are running with the boarding schools here in Switzerland, that we now plan to expand to the rest of Europe, because we've come to realize that this impact and of kids going back to their homes and not being able to go back to school, or having that eating disorder being a reflection of their insecurity, is just such a vivid reality that we're living as we're discussing with those schools. Thank you very much for connecting those. So with the next question is really around the signs that the family and the friends should look at in the loved ones when they suspect that they may be suffering from a body image issues or eating disorders. How would you advise then the families to be aware of those forthcoming signals, I should say?
Sure, I'll list the main signals or main signs to look out for. And before listing them, I'll also add, so that some families don't feel guilty, that they develop in a very secretive way. So it's not always that easy to notice them as a family. But keep your eyes open for changes around the general behavior around food. So someone who's skipping meals, someone who's eating a lot in the bedroom and didn't used to do that, someone who's suddenly eating a lot less than before, or eliminated food groups suddenly, someone who's going to the bathroom after each meal, actually, that's purging behavior, and someone who's spending a lot of time in front of the mirror would be more in the body image problematics, and someone who's hiding food in the pockets, maybe. Anything that shows you that there's a complicated relationship with food and the body would be signs to look out for. And the various, and people with eating disorders also get very creative with them.
Yeah, I was about to ask. I mean, this is the kind of creativity that we, of course, it's a very serious disorder, so we are not making anything funny out of this, but it's impressive to see how creative people can be with that, right?
Mm-hmm. Yes, you'll have. I've seen in when I was meal monitoring clients, cutting very small pieces of food and hiding them between the broccoli and other meat, and that's why I say it's actually not that easy to spot them. But what you will see, depending on the eating disorder, is the weight. That you'll see a sudden drop in weight, very worrying. Gain of weight, you can question it. It can also be for medical and lots of other reasons too.
And I'm tempted to add that the family that lives close to the person of concern doesn't see that evolution, because it's a slight evolution. It's a very, very, very continuous evolution. It's not like from one day to the next. I mean, it's gradually.
Yes.
And then it's basically that story of that pan with the water in it. If you're putting a frog in cold water, or if you're putting it in boiling water,
Yes.
that's that kind of difference you see, right?
Yes, it's very insidious, small changes day to day. What I tell families who ask that type of question, or the calling the practice because they want to have a bit of information, could he be having an eating disorder? Other than to ask the question directly, it could be to organize a meal and see where it's an invitation, and see how the person reacts. If they come and eat everything and it's normal interactions, then I wouldn't say be completely reassured, but it gives you some information. If the person says, oh, well, I'll come after the meal, or, oh, I have a meal last minute planned at the same time, but I'll drop by right before, I'd be more worried, because those are pretty typical signs that the person's avoiding being seen around food.
That's a very, very
Not-
good insight.
Not
Thank
to
you.
trick your loved one, but simply to gain information. And again, the best thing is always to ask.
But we're coming to the conclusion, to the fact that basically people living closest to the person of concern may not be able to see that difference. So you're completely on this line, and this is really, it's a striking reality, because I would have thought that people that would be closest to the person of concern would be actually able to spot it from a distance. But what you're telling us is that actually it's more like a friend that would come every other month that would be able to say, oh my God, you've put on
Something's
weight, or
changed.
right. Whereas people living close to that person of concern may not.
And sometimes nobody at all, because it's a lot of obsessions also in the head, and it's a whole process in the mind of the person. Sometimes the body doesn't change shape at all, and I gave that as the obvious sign, but sometimes even that one we don't pick up on it, and it's not easy.
Okay, I'm not throwing difficult questions at you, but it's a passion we have in common on this subject. So another study that I found was showing that anxiety and stress is directly linked to COVID-19, is causing a number of body image issues among not only women but also men. The research led by Professor Viren Swamy of Anglia Ruskin University, known as the ARU, and published in the journal Personality and Individual Differences, involved 506 UK adults with an average age of 34 among women, and the study found that feelings of anxiety and stress caused by COVID-19 were associated with greater desire for thinness. Among the male participants, the study found that COVID-19 related anxiety and stress was associated with greater desire for muscularity, and anxiety also associated with body fat dissatisfaction. Melissa, how common are such disorders in men, and have you seen a rise in such cases in Kusnacht practice? And would you be able to tell us what would be that projection on women too?
Sure. So first, I'm really glad that we're talking about eating disorders in men, because it's a fairly recent topic, and I'll explain more how you see the influence of cultural factors. When I said it's complex, it's biology, psychology, and social factors, well, there's also cultural, and how culture also shapes eating disorders and other mental health conditions, because there are men with anorexia. Anorexia, for those who are listening who may not know, it's really a pattern of restricting food and having a weight that's way below what it should be.
So we're talking
BMI that's
below 20?
below 18. I'd get worried already that we're going somewhere there.
Okay.
And then in men, we see anorexia too, but now we call it reverse anorexia or muscle dysmorphia, which is not an obsession with being thin, which is a very more of a women eating disorder. Not to say again that there's not men. For men, it's this obsession with being as lean as possible. So really as much muscle as possible. So where someone with anorexia will restrict most food groups and they'll eat very little and become very thin. Someone with reverse anorexia, so more men, but again, not to eliminate that some women also fall into that, they will eat a lot of proteins and they'll eliminate maybe sugar, carbs, but they'll eat protein every meal, nothing else for prolonged periods of times, with the idea of, again, being lean, etc.
But
Muscled, yeah.
So just muscles on skin.
Exactly.
That's a very, very precise description
Yeah.
of the situation.
Yeah, it's exactly what we see in more frequently in male eating disorders, and it goes a lot more unnoticed, which is why we talk a lot less about it, because a man that's very muscular, we don't see it necessarily as problematic in our society. A woman that's very thin, there's this message where, well, in publicities, it's very thin women, models, but if you're also anorexic, so you'll go to treatment. But men, we won't send them to treatment as easily. So they don't have the same access to healthcare all the time, which isn't supportive of these people either. But if we look at the process behind, the level of obsession around food and the suffering is immense for both. It's exactly the same process behind, but it just manifests itself in different behaviors. So that was a small word on the impact on men, since you asked, because I thought it was very interesting to talk about it. And we see a lot in bodybuilders. That's a population with a lot of eating disorders. And then at the Kusnacht Practice, I can't really pronounce myself if we saw a rise specifically in eating disorders, but we work very integratively in the sense that people may come to us with a specific problematic, but we work on the mind, we work on the body, we work with nutrition, on so many different aspects that we anyway always address this question around food and nutrition. And often we discover quite a lot of things actually in the relationship to the body, and whether it's disordered or not. For a lot of clients, we actually do some work on that too, to improve that relationship with themselves, for the quality of life, overall quality of life.
And then in the same vein, the research also indicated that it wasn't only fears around the virus itself which had contributed to serious mental health issues, but the restrictions and the lockdowns that have been brought in to combat it. So in your opinion, Melissa, how big are factors like isolation and curb movement and socializing in case of body image and eating disorders?
I think that depends on the person. Some people love isolation and have no problem with it. Some people even seek it. They'll go camping in the middle of nowhere to be sure to be unreachable. For some, it's very difficult. So I think, like I explained at the beginning, it's an interactions of many factors. For some, it will come into play that being isolated doesn't give them perhaps access to some support, or makes them feel anxious or isolated and lonely, which is not the case for everyone. Some are isolated and not lonely. And all that is going to be some of these many factors, more of the psychological factors actually, in these big pictures of all the things that can lead someone to develop a problematic relationship with the body and food.
And finally, to close this interview, what advice do you give to someone who believes that may be suffering from such disorders?
Actually, my first advice would be to try and have 3 meals a day. There's lots of different eating disorders. We didn't go into that today, but most have in common that meals are either eliminated food groups or skipped or too much, etc. Try to have 3 small meals a day, and that could be a first step, and experiment, see what happens. If that's very difficult, or if the obsessions are really taking over your life, my only advice really would be to seek professional help, because you can get out of it. There's help available, and it's not easy to get out of these eating disorders alone. And at the Kusnacht Practice, for example, we do what we call personalized medicine, where we really look into not one diet fits all, because that just doesn't work. And as I said earlier, with the lockdown influences, diet usually set you up for failure, because you'll restrict and then you'll end up binging, and for some they get lost in this cycle. And there are places like here, the Kusnacht Practice, where we do this personalized nutrition medicine, where we look at what your body actually needs, and it will help you reach some goals, will help you recover from these obsessions, etc., but in a way that doesn't create suffering, and that will really allow you to lead a happy life again. Mm-hmm. Ultimately, that's the goal, right? It's that you're freed from a disorder that's eating away at your whole life, which is how people truly experience it. They become isolated and lonely and just prisoner from these obsessions.
Well, this is a great way to conclude this interview, by talking about, moving on to finding your best way and in your best life in this development. And eating disorders certainly prevent finding this opportunity. And I very much measure now what we're doing here at the Kusnacht Practice to achieve this. Thank you very much, Melissa, for being with us today. I will look forward to, because it's really a very interesting topic. We have way more to discuss on eating disorders.
Yes.
So stay with us as we go along, and there will be more podcasts to come.
Thank you very
again.
much.